Hi, good day folks. I'm EMT Shock and today we will be discussing three different types of shocks that an EMT might face or come upon within the field, right? So we're going to be discussing hypovolemic shock, cardiogenic shock, and distributive shock. We'll be talking about what are the causes, the signs, and the possible EMT actions for each of these shocks, right? So for hypovolemic shock, let's start with that one. Hypovolemic shock is a major loss of blood or fluids in the body. Some of the signs that someone could basically be displaying for hypovolemic shock is that the patient could have pale, cool, clammy skin. Their pulse is very fast, right? And low blood pressure reading is also indicative of them going into hypovolemic shock. They are weak or absent radial pulses, so you basically have to palpate at the carotid pulse, right? And anxiety and confusion is something that could also be present in those patients. So for an EMT, your action, as I said, hypovolemic shock is a massive loss of blood, right? So your main action as an EMT would be to control the bleeding, right? And to stem it where it starts, you understand? So you're gonna lay a patient flat and give them high flow oxygen, right? And so that basically would be 15 liters of oxygen and via a non-rebreather mask, you understand? The highest amount you can give. And you gotta keep that patient warm, and rapid transport is something that you would have to do for that patient immediately, right? So it's a load and go situation for hypovolemic shock because that patient would need certain fluids to be replenished in their body. So they would need an ALS intercept and for that advanced EMT to provide an IV access and provide them with the necessary blood and normal saline fluids as well, right? To get that patient stabilized. The next shock that we are going to discuss is cardiogenic shock. Now, the cause of a cardiogenic shock would be the heart can't pump well enough anymore. That could be from a CHF, congestive heart failure, or a heart attack. You understand? Anything that would cause the heart to stop pumping the blood sufficiently. You understand? So some of the signs for a cardiogenic shock would be chest pain, right? Sometimes the patient might be experiencing it as angina pain, but it's severe chest pain, right? Shortness of breath. When auscultating as an EMT, you would sometimes hear crackles in the patient's chest as well, right? If you hear it. So the patient's skin condition, circulation would be something where you would find the patient skin condition being cool and clammy, right? And the pale, so the skin color would be pale and so forth. You would also palpate a weak pulse, and you would also notice low blood pressure readings as well. Now the EMT's action in these in a cardiogenic shock situation would be that the EMT would have to first remain calm, right? And possibly position the patient upright. If their work-off rate for breathing is hard, if they're breathing hard, position them upright so they can catch their breath a little bit more. You would definitely provide oxygen to this patient, right? You would also avoid large fluid boluses, but that basically would be for an advanced EMT. So as an EMT, you would identify that the patient is going to cardiogenic shock. When you report that to ALS intercept, you would, because a load and go situation, this as well. So you would basically report what your findings. They would identify that it's a load and go situation, and they would identify that it's a cardiogenic shock situation. So they wouldn't give that patient large fluid boluses like they would give someone who is going through a hypovolemic shock situation, right? So you would monitor this patient's vitals right through, and then you would also provide priority transport, as I said earlier, right? So that's what you would do for a cardiogenic shock patient, right? And the third shock that we would discuss would be the distributive shock. right? So for that patient who's going through a distributive shock situation, this is normally a case where there's vessel dilation, right? So blood vessels would be dilated significantly, right? So in a case where there's distributive shock, it's usually a situation where sepsis has set in, or they're having a severe anaphylaxis type situation, right? In the case of distributive shock, right, some of the signs that you would have to look for would be, as it relates to septism, right, when there's sepsis set in, one point to note is that the patient would be basically have some form of internal infection, some internal wound or damage to tissues or so forth, and it would become infected and so forth, leading to sepsis, right? So some of the signs that you would look for in a patient of that nature who is going through distributive shock would be warm skin, right? So the patient would have warm skin. Usually that's an early sign of sepsis, or probably hives, warm skin or hives, right? Hives would be an early sign of anaphylaxis, right? Anaphylactic shock. The patient's supposed to be rapid, right? So they would be rapid pulse, tachycardic pulse. They would also have a low BP, as you would see through all 3 times of shock, right? It is evident in all 3 low blood pressure reading. The patient would also be confused, and they would also have breathing issues. So you don't say you have to maintain that airway and so forth by ensuring that you provide enough oxygen to keep the airway patent, also ensuring the airway remains open. So if in the event of anaphylaxis, you would assist the patient with an EpiPen if it is available and if it is needed, right? You would naturally lay the patient flat, and unless the breathing is difficult. So if the breathing is difficult, you're not going to lay them flat, just like with the cardiogenic shock. You would also keep this patient warm, and rapid transport is definitely imminent for these patients. And as it relates to all 3 patient presentations, rapid transport is imminent for both hypovolemic, cardiogenic, and distributive shock, right? So that is my rundown on all 3 types of shock. Thank you very much. Have a good day.